Even though Donald Trump finally did the right thing and authorized his administration to work with Biden folks, we lost 3 weeks as he blocked the lines of communication up until now. Today, Health Secretary Alex Azar said his people are now cooperating with the incoming administration. But is it possible that the damage has already been done? Senator Chris Murphy of Connecticut, he raised some worrisome issues in a piece that came out today, and I'll quote, "We're far from out of the woods yet because it's entirely possible that Trump's plan is as unworkable as every other plan his team has devised for pandemic response. For instance, 9 months into the pandemic, healthcare providers still don't have enough personal protective equipment because the president has been unable to put together a plan to produce and distribute enough PPE. What if his plan for vaccine distribution is just as miserable as his plan for PPE production?" My next guest, he recently penned a piece in the Post with the headline, "Every day spent obstructing the transition means more COVID-19 deaths," so we know where he stands. He's also got the perfect background to talk about this. Dach, he's founder of Protect Our Care. He's also a former top official at HHS during the Obama administration, where he was also the Ebola coordinator. And Leslie, thank you for a few minutes.
Pleasure to be here. Thanks for having me.
You were quoted as saying, "Vaccines don't matter, vaccinations do." Could you explain for my audience what you mean?
The task of taking vaccines and delivering them and giving them to millions of Americans and building the trust that Americans need to take them is a daunting task. We will manufacture the vaccines. Getting them to people is the challenge.
You know, I asked this question to former Secretary Sebelius last week, and from a layperson, you've got 3, maybe even 4 vaccines when it's said and done that'll have the efficacy to be valuable and productive. But as I understand it, each of them have different protocols. They have to be stored at different temperatures potentially, and the capacity to do so isn't uniform across this country. How's that going to work? They're not all exactly the same. Who works out who gets what? Is that a state decision? Does the CDC decide for everyone and who gets it and when?
No, it's a joint decision, really, and that's part of the dilemma that we're in because, one half of the partnership, the federal government, simply hasn't been doing its job. But really, the general guidelines will be set by the CDC, but the implementation needs to be local. And that's why states need the help from the federal government that they haven't gotten yet.
You know, I've spoken to some officials at the state and local level in New York, for example. And they say, you guys in the media think that we're in constant coordination with the Trump administration. We are dying for direction and logistical information that we're not getting right now. And if you guys think that we have this extra time in the middle of a pandemic to handle all this coordination on our own here, you're sadly mistaken. Are you hearing the same things, that states aren't getting as much direction as we think they are, even though we're ramping up this production of this vaccine? They're just not getting clarity that they desperately need and should have had it before now.
Unfortunately, that is completely true. Every governor's office that I speak with says the same thing. They don't have the clarity they need to plan. They have no assurances of how things are going to work. They don't have the personal protective equipment or the syringes or the vials to really do the job they so desperately want to and need to do. I would say that there are 2 other things that this administration needs to do to make it easier and better. One is there's only one president until January 20th, and that's Donald Trump. And so they really need to step up their game. They can make a difference here if they choose to do it, if they get back behind the driver's seat and do the job they're supposed to do. The second thing is that the Congress has to pass a COVID relief bill, not only to help people's economic situation, but also to give the states the funds they need for PPE, the funds they need to distribute this vaccine, and to have all the tools they need to do the job. And unfortunately, so far, Majority Leader McConnell in the U.S. Senate has refused to negotiate or seriously consider any of these measures. And we only have a few more weeks for that bill to get done.
You know, Leslie, I just had a conversation with the folks over at the Century Foundation who put together a report about this cliff that we're looking at come December 26th. And I didn't put it in context with the vaccine and in terms, but they're kind of tied together, aren't they? If you add another 12 million people who all of a sudden have to worry about a roof over their heads or putting food on the table, that does complicate this, doesn't it?
It complicates their lives in addition to the vaccine. And so the notion that we would stop all these programs that have been beneficial, whether it be helping people with food, helping people pay rent, helping people with unemployment insurance, at a time that this is raging, is just simply wrong. And the Senate has the power to fix this. But so far, they won't. And, these run together. If we want to get our economy working, we need to get this virus under control.
I saw a poll today, 58% of Americans said that they'd be willing to take the vaccine. That's up from September, if we want to look at something half full when it was at 50%, but still, that's more than 4 in 10 Americans that right now don't sign on. What kind of an education campaign or a PR campaign needs to happen to get that number up to the point where we can have herd immunity?
A lot of work needs to be done, but I do feel optimistic about that, both because of what you've seen, as you described in the polling, but also because the polling also shows that people have faith in Joe Biden. They approve of the way that he's handling this virus. I think his actions will go a long way to restoring trust in the process. I think the FDA's actions in improving the vaccine, relying on scientific evidence, hopefully will also give people confidence. But it's a problem. But I think the proof here will be in the pudding. If we have an effective rollout and people listen to Joe Biden and see and trust him and see the work that the FDA is doing to listen to the science, people's faith will increase.
All right. Well, I certainly hope you're right. And I appreciate the time again today. Thank you.
Thank you very much.
All right. Coming up next, we're going to switch gears. President Trump once again is talking about the war on Christmas, which is just another imaginary battle that he's waging. But it's actually his own wife who's complaining about Christmas. And as they say, we've got the tape to prove it. But tell your kids to leave the room because Melania's comments, they're rated R.